We now have the honor of introducing Dr. Peter McCullough and best-selling author John Leake, who have just co-authored the book Courage to Face COVID. Dr. McCullough, who is joining us over Zoom from Dallas, Texas, is an internist, cardiorenal specialist, and epidemiologist. He is the most highly cited physician in the cardiorenal specialty. He practices both internal medicine, including the management of common infectious diseases, as well as the cardiovascular complications of both the viral infection and the injuries developing after the COVID-19 vaccine. Since the outset of the pandemic, Dr. McCullough has been a leader in the medical response to the COVID-19 disaster and has published pathophysiological basis and rationale for early outpatient treatment of SARS-CoV-2 infection. The first synthesis of sequenced multi-drug treatment of ambulatory patients infected with SARS-CoV-2 in the American Journal of Medicine, and subsequently updated in reviews of cardiovascular medicine. He has 46 peer-reviewed publications on the infection. Dr. McCullough testified over Zoom to a Bezdin in Eretz Yisrael last summer in front of a group of Rabbanim here in Crown Heights in October 26 of last year, and at the U.S. Senate Committee on Homeland Security and Government Affairs. He has spoken worldwide on the topics of COVID treatment and the COVID injections. Dr. McCullough has now had a year and a half of dedicated academic and clinical efforts in combating the SARS-CoV-2 virus, and in doing so has reviewed thousands of reports, participated in scientific congresses, group discussions, press releases, and is considered among the world's top experts on COVID-19. Dr. McCullough.
Well, thank you so much for having me. I'm just going to stay on just for a second, and then hopefully be able to introduce John Leake. He's just joined actually from a prominent residence in Dallas. John, welcome to the program. You're on mute, so if somebody can unmute John. John, just hang on one second.
Yes, sir. Thank you. Thank you for having us. It's an honor to be here with you, gentlemen and ladies.
We want to introduce our new book, Courage to Face COVID-19, Preventing Hospitalizations and Deaths While Battling the Biopharmaceutical Complex. John, why don't you give the audience just a few words about the genesis of the book?
Well, as I observed from the gentleman who spoke just before we came on, I think our audience has picked up on this, that what we're dealing with in the world right now is only really properly described as criminal activity. I'm a true crime author. In early 2020, I began to perceive that there was, at a national and even international level, something like a criminal conspiracy that was being perpetrated. It started with representing the SARS-CoV-2 virus as an unassailable enemy that equally threatened all of society, all people, regardless of their age and their health status, and that all we could do is shelter in place, stay at home, and wait for a vaccine. And as outlandishly strange as this sounds, it's very well documented. I mean, some of the key figures that the gentleman before us referred to were plainly stating this in Washington Post op-eds. Bill Gates spoke about this wrote about this very plainly on his blog, that there is no way of dealing with this adversary apart from staying at home and waiting for a new innovative vaccine. And once the world is completely vaccinated, every man, woman, and child on earth, then something like the normalcy that we've long known can be restored. So I knew that this was something like a fraud, but at the same time, I knew that as an investigative author, I would need something more than my own ability and my own knowledge. So I sought out the authority of Dr. McCullough, who had set forth his view of the matter. I contacted him exactly a year ago, and we agreed that we were going to write a book about this. we wrote it in a narrative form. We tell the story in real time, sort of as SARS arrives, Dr. McCullough and his colleagues attempt to find ways to deal with it. And then they encounter this very strange resistance, of which I'm sure you're all very familiar. And what is this resistance to treating patients, to just fulfilling his Hippocratic oath? So it's a crime story. And Dr. McCullough, I believe, is the sort of hero of trying to counter this crime.
Well, thanks so much for that introduction. I'll just add my color. It's been an honor to work with John Leake. He's a best-selling author. It's the only book on COVID-19 where there is an experienced author that really tells a story in narrative form that's understandable. It's nonfiction. It's global and gives the reader a fast-paced understanding of how things were coming together early on. And I've testified under oath, and I've said that the suppression of early treatment was very intentional to create fear, suffering, hospitalization, and death in order to prepare the world for mass vaccination. And as many on this call recognize, I defended the rights of the Orthodox Jewish community in rabbinical court now several months ago, and were successful. And my testimony, along with that of Jay Bhattacharya of Stanford, was relied upon all the way up to the Supreme Court in overturning 4 out of the 5 mandates. The only one that stands now is by strings attached federal healthcare dollars to mass vaccination. We're gratified to see now across the whole country that mandates are being dropped. Today, I was informed American Airlines, one of the biggest employers in Dallas-Fort Worth, has dropped the mandate. Starbucks, IBM, General Electric, United Airlines, FedEx, and we can go on and on. I think, thankfully, our message, in a sense, our counter narrative, our true narrative, put up against the false narrative is taking hold. Now, the book is available through the website and will be at all major booksellers, but currently at Amazon. But couragetofacecovid.com, you can find it there. I'll stop here and open it up to the audience for any questions for John Leake and myself. We may not have the technical ability for questions, but I do want to, at this late hour, I do want to thank everybody for joining. I know many of you joined from the East Coast. And again, thank you so much for listening. Thank you so much for your courageousness and your devoutness to the fundamental principles that I think so many of us espouse in our lives. John, any final words?
Well, I got from what I believe he comes from your community. I got to be had a collaboration with Dr. Vladimir Zelenko from Monroe, New York. And he told me a bit about the sensibilities of your community. I see Barry Wernick is on the call. He's an old friend of mine from Dallas. What I think is that people who have a sort of core of ethical structure and an interpretive structure based on an ethical worldview are going to be the way forward out of this. So I concur with Dr. McCullough. I thank your ancient and ethical community for your principled stand on this, and thank you for inviting us onto this forum this evening. And I wish you all a very peaceful and pleasant evening.
Dr. McCullough, can you hear me? It's Dr. Hershey Klein. I have a protocol I'd like to run past you for treating myocarditis. And if you could give Bracha your information, how I can call you or contact you, that would be very helpful. Okay, I'd like to run it past you. Thank you very much, and thank you for all you do, both of you. It's the world is upside down, and we have to take our stand and fix it.
Hi, Doctor. Let me tell the audience on Zoom.
We can't hear you.
You can't?
No,
They could.
you
You-
can hear me, but
Okay.
they can't hear them.
If you want to raise your hands, just raise your hand electronically. If you have a question for Dr. McCullough or for John, and I'll unmute you. There was one topic that was very important, though, that I just want to bring up. I had mentioned it to Dr. McCullough yesterday. People in the community, of course, this is a very marriage and child-centered community, and people are concerned. They want to know about dating someone, a male or female, who was vaccinated. The question is if it can affect male fertility, if it can affect female fertility. Unfortunately, I know the answer, but they want to hear the answer from the doctors. And if the effects of the vaccine can be passed on from one spouse to another, which I also know the answer already, but very, 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 very tragic. So if either one of you can address that, thank you. And then we'll, and after that, anyone who wants to ask a question from the Zoom audience, please raise your hand. Sorry.
Thank you. Yeah, just quickly, we have a short night tonight. Quickly, the fertility was dropped in Moderna in an animal study produced to the European Medicines Agency. And then in the Pfizer biodistribution study, the lipid nanoparticles were clearly shown to hyperconcentrate in the ovaries. And that's been shown previously by the Chinese in peer-reviewed publication. The first evidence that the vaccines actually interfere with maternal fetal health is actually from the Department of Defense epidemiologic database, where the rates of fetal loss are double or triple in female members of our military right now in 2021 compared to the era before vaccination. So it doesn't look good. I think all experts would agree there are no long-term assurances on safety. Myself and Dr. Raphael Stricker, who runs the largest fetal loss program in the United States in San Francisco, published in Trial Site News, that the vaccine should be considered pregnancy category X, that they actually should not be administered in pregnancy at all because they have a dangerous mechanism of action, and we have no assurances on safety. Now, if someone has taken a vaccine over the long haul, can they potentially pass on the contents of the vaccine or the code for the spike protein to their progeny? And the answer now is possibly yes, in a paper by Marcus Alden and colleagues, senior directed by Dr. D. Marinis Yang at Malmo, Sweden. They've demonstrated at least partial reverse transcription of the code for the spike protein into human chromatin. And that's with the Pfizer vaccine at physiologic concentrations in human hepatoma cells. So this is disturbing because if this is true, that there are some cells that may indeed be impacted and permanently altered with the vaccines. And that could include gametocytes. That means sperm and egg. And if indeed that's true, that means the progeny will forever be affected. There needs to be a lot more validation to come up with these conclusions, but all the findings I've outlined are extremely concerning and disturbing. It's clear the best way to stay healthy is to never take the foreign code for the spike protein into one's body.
Thank you, Dr. McCullough. Can you speak about, I heard that it can, that it affects male sperm motility. Dr. Urso had mentioned that to me.
Now, I'm unaware of that. However, I do want to emphasize that whatever we see with the respiratory illness, we've seen with the vaccines, because the spike protein causes the same problem. There is a paper published in 2019 by the Chinese of those with the respiratory illness. It was men developing testicular pain, and they underwent ultrasound examination with a very regimented coding scheme for orchitis, or testicular inflammation. And indeed, they found the majority of the men had evidence of orchitis. That's with the respiratory infection. So it's well within the spectrum of reason that after the vaccine, there could be testicular injury. We know this happens with other viruses, including mumps. It's one of the main support reasons for the mumps vaccine is to avoid male orchitis.
Dr. McCullough, you got cut off a little bit. There's a bad connection. I'm sorry.
Yeah, I say that, this is known with other viruses. With the mumps virus can cause testicular sterilization or mumps orchitis. It's one of the major rationale for younger individuals to take the mumps vaccine.
So you got cut off like a bit. So I'll just summarize what I think you said, that if the spike protein of the virus can cause this problem, then we can assume that the vaccine can cause this as well. And what do you know about the effects of the vaccine being transmitted from one spouse to another?
There has never been definitive proof of shedding. There's one recent paper declaring it's been observed, and I don't think it's a solid enough support. So far, it's never been scientifically demonstrated that indeed they're shedding. It's a theoretical concern. My general advice, if someone takes the vaccine, since we know it's circulatory in blood and other body fluids, is to refrain from any close contact for at least a month after each shot.
I'll mention that I'm friends with a researcher in Israel, and very tragically, she's been having women call her from all over Israel and from the United States as well, who have been in terrible pain after their husband has been vaccinated, and they've lived with their husband, and it's caused such destruction of family life. It's been absolutely horrible. Yeah.
So let one more question, and unfortunately, we're going to have to sign off from Dallas. Any more questions?
I see I have 3 people raise their hand. Let me see just a second.
Pick the best one.
I have to find that, just a second. 1 second, I'm sorry. Okay, I think Shoshana was first.
Yeah.
Go ahead.
Hello. Thank you so much for all the wonderful work you're doing. I wanted to ask you regarding this threat of the Marburg, virus and this treaty that they're getting ready for in view of releasing this virus. What do you suggest people do? Because it sounds like horrendous, to protect themselves.
Yeah, many are concerned about a next pandemic. The Marburg virus is probably the most horrible of the, imagined possibilities, a hemorrhagic, fatal illness. Let's hope that it never materializes. I think the best thing to do is to strongly oppose the WHO treaty. The WHO treaty gives sovereignty from nations up to the WHO without a fair and elected process, without due process, and without any type of charter that we can understand what's going to happen. The WHO wants the ability to declare worldwide emergencies, to basically dictate responses, including mass vaccination. They want control over information. They want this to be completely enforceable by international law, and they want funding. They want this funding to be memorialized into international law. And then lastly, they have no signals of having a check on conflict of interest, including large countries and foundations such as the Gates Foundation. And watch out for the American amendments. The American amendments are suggesting that this would not come for any type of senatorial or congressional vote, that this could be done by executive order, maybe not really an official treaty, but still binds us. So none of the things that have come over from the Biden administration back over look desirable. It's coming up May 22nd. I think this group is very, active in terms of calling their local representatives, state representatives, and senators, and strongly opposing it. All healthcare is local. And if there's any community that would understand that there needs to be individualization of approaches and understanding the sacred doctor-patient relationship, it's this community. So we hope that your community comes out big and strongly opposes adoption of the World Health Organization Treaty. I'll let that be the word. Thank you so much for allowing me and best-selling author John Leake to join your program tonight.
Thank you
Thank you
very
so
much.
much,
Thanks.
Mr. Leake and
Thank
Dr.
you.
McCullough. Thank you.
Thank you.
Thank you for the invitation. It was an honor. Thank you.